If you're over 40, trying to stay sharp, protect your memory, and avoid chronic disease, there's a good chance you're taking at least one daily supplement. Maybe it's a multivitamin, something for your joints, or a brain booster you heard about online. You do it because you care about your future, because you've seen what can happen to people who don't. But what if I told you that some of the most common vitamins on store shelves, ones you might be taking right now, could be quietly increasing your risk of stroke? Not years from now, not with some rare overdose, but today in your current routine. According to research from Harvard Medical School and Johns Hopkins University, 4 widely used vitamins, taken in certain forms or amounts, can double your risk of a life-altering stroke. And these aren't fringe findings. They come from controlled studies, real patient outcomes, and global stroke data. Most people take these supplements with good intentions. They want to feel better, age better, and avoid medication. But the dark truth is, your body doesn't always process synthetic nutrients the way supplement companies assume it does. For some people, these vitamins cause blood vessels to stiffen, inflammation to spike, and clotting to become dangerously unstable. In this video, we're pulling back the curtain on these 4 vitamins. I'll show you what they are, what the science really says, who's most vulnerable, and how you can make safer choices that still support your brain and body without gambling with your future. Now, before we go any further, I want to hear from you. Have you ever taken a vitamin or supplement hoping to protect your brain or heart? Or maybe you were told it was just preventative. Drop a comment below and share your experience. You might help someone else who's in the same boat. And if you're serious about protecting your health with facts, not hype, be sure to like this video and subscribe to the Wellness Vault. This channel is your go-to source for wellness truths the mainstream won't tell you. Now let's begin. Number 4 is vitamin D. Vitamin D is often celebrated as one of the most essential nutrients for modern health. It supports your immune system, regulates hormones, improves mood, and helps absorb calcium for stronger bones. But there's a growing danger that almost no one talks about, especially among older adults. When taken in high doses without the proper cofactors, vitamin D may silently increase your stroke risk. Here's what's happening inside your body. Vitamin D increases the amount of calcium your intestines absorb from your diet or supplements, but it doesn't control where that calcium goes. Without enough vitamin K2 to act as a guide, calcium starts settling in places it doesn't belong, like your arteries. Over time, this leads to calcification, turning flexible blood vessels into stiff, clogged pathways that struggle to deliver blood to the brain. This isn't just theoretical. Studies from institutions like Johns Hopkins and findings published in Stroke, the Journal of the American Heart Association, show that elevated vitamin D levels, especially from supplements, are associated with a higher risk of ischemic stroke. In Finland, long-term vitamin D supplementation at high doses led to increases in arterial stiffness and inflammatory markers in otherwise healthy adults. And the problem is compounded by vitamin D's fat-soluble nature. Unlike vitamin C or B vitamins, which flush out if you take too much, vitamin D builds up in your fat tissues. That means even seemingly moderate doses of 5,000 IU daily can accumulate to dangerous levels over time, especially if you're not getting enough magnesium or if your kidneys aren't functioning at their peak. This is especially relevant for people over 50 who are more likely to be prescribed or recommended vitamin D supplements. They're also more likely to have lower magnesium levels, decreased kidney function, and mild to moderate arterial plaque, all of which increase sensitivity to excess calcium in the blood. Combine those risk factors and you've got a perfect storm. It's also worth noting that some people take vitamin D because it makes them feel good, especially during darker months or in colder climates. That's understandable. But mood benefits should never come at the cost of vascular health. The mistake is in assuming more is always better, especially when other nutrients aren't in balance. If you take vitamin D, the solution isn't to panic, it's to be smart. Get your blood levels tested regularly. The ideal range for most adults is between 40 and 60 nanograms per milliliter. If your levels are higher, you may need to cut back. Always pair your vitamin D with vitamin K2, especially the MK7 form, and make sure you're getting adequate magnesium daily from leafy greens, seeds, or supplements if necessary. Also, aim to get at least some of your vitamin D naturally. 10 to 15 minutes of sunlight a few times per week can help maintain healthy levels without risking overload. Foods like cod liver oil, pastured egg yolks, and wild salmon offer vitamin D in its natural form, balanced with fats and other cofactors your body understands. The point isn't that vitamin D is harmful, it's that high-dose, isolated vitamin D, taken without proper balance or testing, can quietly sabotage the very arteries you're trying to protect. And when those arteries supply your brain, the consequences can be devastating. Stroke doesn't always come with warning signs. That's why prevention has to be smart, not just well-intentioned. Coming up, we'll shift from identifying risks to building real protection, science-backed strategies to lower your stroke risk, and nourish your brain for the long term. Don't miss what's next. Number 3 is calcium. For decades, calcium has been the gold standard of bone health advice. Doctors, commercials, and even school health programs drilled it in. Take your calcium or your bones will break down. And while calcium is undeniably important for skeletal strength, the way it's often consumed, especially in supplement form, can come with unintended and serious consequences. Calcium supplements, particularly when taken alone or in high doses, have been linked to a higher risk of stroke. Not because calcium itself is harmful, but because without the proper cofactors, specifically vitamin K2, your body struggles to direct that calcium where it's needed. Instead of sending it to your bones, your body can mistakenly deposit it in soft tissues, including the walls of your arteries. When calcium builds up in your blood vessels, a process known as arterial calcification begins. These calcified arteries become less flexible and more prone to injury and inflammation. Over time, this can lead to blockages and make the arteries feeding your brain significantly narrower. The result is a much higher risk of ischemic stroke, especially if you already have high blood pressure or pre-existing plaque. This isn't just a theory. It's been demonstrated in major clinical studies. A landmark study conducted by Johns Hopkins University found that people who took calcium supplements had a 22% higher risk of developing coronary artery calcification. That's a direct path toward heart attack or stroke, even in people with otherwise normal cholesterol levels. What makes this even more alarming is how silently it happens. People who take calcium often feel like they're doing something smart for their health. There are no warning signs, no pain, no obvious symptoms, until one day, blood flow to the brain is blocked and everything changes in an instant. And it's not just older adults at risk. Postmenopausal women, younger adults trying to optimize bone density, and even teenagers using fitness-focused supplements can all be affected. The danger lies not in calcium itself, but in its isolation, taking it without the nutrients that help the body manage it safely. The fix isn't complicated, but it does require awareness. If you're taking a calcium supplement, it must be paired with vitamin K2. This nutrient acts like a traffic cop, directing calcium to your bones and away from your arteries. Without it, you're inviting calcium to accumulate in places it doesn't belong. Magnesium also plays a role in keeping this process balanced and preventing calcification. You should also consider getting most of your calcium from whole foods. Leafy greens like kale and bok choy, sardines with bones, tahini, and fermented dairy products all contain bioavailable calcium, naturally combined with fats and trace nutrients your body uses to regulate absorption. Ultimately, the goal isn't to avoid calcium, it's to respect how your body handles it. When you take it in isolation, especially in large doses, you're rolling the dice with your vascular health. And when the arteries affected are the ones supplying your brain, that risk becomes far more than theoretical. Next, we'll look at another common health vitamin that's been misused and misunderstood for decades, and how it might be quietly raising your stroke risk each time you swallow it. Keep watching. Number 2 is vitamin B12. Vitamin B12 is often described as a miracle nutrient. It's involved in energy production, red blood cell formation, DNA repair, and proper nerve function. People take it to fight fatigue, improve memory, or as part of a daily multivitamin. But there's a darker side to B12 supplementation that almost no one talks about, especially when it's combined with high doses of vitamin B6 or taken in the wrong form. At the center of this issue is a compound called homocysteine. Homocysteine is a natural amino acid your body produces during metabolism. In small amounts, it's harmless, but when levels get too high, it becomes toxic to your blood vessels. Elevated homocysteine irritates the inner lining of arteries, promotes inflammation, and makes it easier for blood clots to form, all of which increase your risk of stroke. B12, along with B6 and folate, is supposed to help lower homocysteine levels. That's why so many people take it, especially those worried about heart health or cognitive decline. But here's the problem. Not all B12 is created equal. Most over-the-counter supplements contain a synthetic form called cyanocobalamin. For your body to use it, it has to convert it into an active form, methylcobalamin. But for millions of people with a common gene mutation called MTHFR, that conversion doesn't happen efficiently. Instead of reducing homocysteine, the body struggles to process the synthetic B12. And in some cases, this can lead to rising homocysteine levels, even when taking the supplement regularly. That means the exact vitamin you're taking to protect your brain could be setting you up for a stroke. One of the most eye-opening studies came out of Norway in 2010. Researchers tracked patients with heart disease who were given high doses of B6 and B12. The group taking the vitamins had a significantly higher risk of stroke than the group taking a placebo. The very intervention meant to protect them had the opposite effect. This doesn't mean B12 is bad. It means context matters. If your body can't properly process the form you're taking, or if you're combining it with other high-dose B vitamins without medical oversight, you may be doing more harm than good. And the scary part? You wouldn't feel a thing. Homocysteine doesn't cause pain or symptoms until the damage is done. If you do supplement with B12, always look for the methylcobalamin form. It's the biologically active version your body can use immediately with no conversion required. And if you're taking B6, opt for P-5-P, not pyridoxine hydrochloride. Just as important, get your homocysteine levels tested. It's a simple blood test that can tell you more about your stroke risk than your cholesterol ever could. Also, remember that real food is still your best defense. Eggs, liver, sardines, and grass-fed beef all contain B12 in forms your body knows exactly how to use without overwhelming your system. The takeaway here is simple. B12 is vital, but when taken in the wrong form, in isolation, or without testing, it can contribute to the very conditions you're trying to prevent. Stroke prevention doesn't start with a pill. It starts with understanding your biology. Coming up next, we'll expose the #1 most dangerous vitamin when it comes to stroke, and the simple reason it's still found in millions of supplement bottles around the world. Don't miss it. #1 is vitamin E. Vitamin E has long been marketed as a heart-healthy antioxidant. You've probably seen it in multivitamins, anti-aging capsules, and skin supplements claiming to reduce inflammation, protect against oxidative stress, and slow the aging process. But buried beneath the glowing marketing claims is a serious, underreported risk, especially when it comes to your brain. When taken in high doses or in the wrong form, vitamin E can increase your risk of hemorrhagic stroke. That's the kind caused not by a blockage, but by a sudden rupture of a blood vessel in the brain. It's far less common than an ischemic stroke, but it's often far more deadly or permanently disabling. The danger lies in vitamin E's effect on your blood. It acts as a natural anticoagulant. It thins your blood, making it less likely to clot. In small amounts from food, this can be beneficial, but when you add high-dose synthetic vitamin E on top of other blood-thinning agents, like aspirin, omega-3s, or even ibuprofen, you may tip the scale too far, increasing the likelihood of internal bleeding. One of the most powerful studies to highlight this risk came from a large meta-analysis published in the British Medical Journal. Researchers analyzed data from over 100,000 participants and found that those taking high-dose vitamin E supplements had a 22% increased risk of hemorrhagic stroke. Not a minor side effect, a potentially fatal brain bleed. And yet, this version of vitamin E, specifically the synthetic form known as DL-alpha tocopherol, is still found in most inexpensive multivitamins and brain booster formulas on the market. It's cheaper to produce, but your body doesn't use it the same way it does natural vitamin E, and in excess, it becomes toxic. The scariest part? Most people have no idea what kind of vitamin E they're taking. They assume it's safe because it's in a supplement. They think natural and over-the-counter means harmless, but the research says otherwise. When you combine synthetic vitamin E with other common health strategies, like daily aspirin, fish oil, or blood pressure medication, you're increasing your stroke risk with every capsule. So what should you do instead? Ditch the synthetic supplements and get your vitamin E from whole foods. Sunflower seeds, almonds, avocados, and spinach contain vitamin E in its full spectrum of tocopherols and tocotrienols, the forms your body actually needs. These natural sources don't overload your system and are balanced with other nutrients that prevent toxicity. If you're taking a supplement, look for natural D-alpha tocopherol, or better yet, a full-spectrum tocopherol and tocotrienol blend from a trusted brand. And if you're already on medications that thin the blood, talk to your doctor before adding any form of vitamin E at all. Vitamin E is not inherently evil, but the way it's been isolated, megadosed, and carelessly included in formulas without context makes it one of the most dangerous vitamins for stroke risk. And because the symptoms of a hemorrhagic stroke come suddenly, often without warning, the time to act is now, not later. Now that we've revealed all 4 high-risk vitamins, let's pivot to what actually works. In the next section, I'll walk you through the science-backed habits, nutrients, and strategies that genuinely support brain health and reduce your risk of stroke without putting your body in danger. Stay with us. Let's take a moment to pull everything together. We've covered 4 vitamins that, while often taken with the best intentions, can quietly increase your stroke risk, sometimes dramatically. These aren't fringe theories or isolated cases. They're backed by published studies, real-world outcomes, and a growing consensus in the scientific community. Vitamin B12, when taken in synthetic form or without proper methylation support, can actually elevate homocysteine and increase vascular stress. Vitamin B6, often paired with B12, poses similar risks when megadosed. Calcium, long praised for bone support, can calcify arteries if it's not paired with vitamin K2, putting your brain at serious risk. And vitamin D, though essential, can become dangerous when taken in high doses without K2 or magnesium, quietly hardening arteries over time. And finally, we looked at vitamin E, particularly in its synthetic form, which thins the blood and significantly raises the risk of hemorrhagic stroke, especially when layered on top of other blood-thinning agents like aspirin or fish oil. These aren't nutrients to fear, but they are nutrients to respect. Used wisely, in the right context, and with the right guidance, they can support health. Used blindly, they can do serious harm. The bottom line is this: don't assume that every supplement is safe just because it's available over the counter. Your genetics, your existing health conditions, and even the forms of these vitamins all play a major role in how your body responds. So here's what to do next. First, leave a comment below and let us know. Are you taking any of these vitamins? Did anything in this video surprise you? Your experience could make a difference for someone else who's trying to make sense of their health decisions. Then hit that like button and subscribe to the Wellness Vault. We bring you clear, science-backed wellness content that cuts through the noise and helps you make smarter decisions for a longer, healthier life. Thank you for watching. We hope this video gave you insight, clarity, and perhaps even the motivation to rethink what you put in your body each day. Stay informed, stay curious, and as always, stay well. We'll see you in the next video.